The health department says it will not impose restrictions on travellers from China. That's the South African health department. Several other countries, including the US, Japan and India, have imposed restrictions due to a quick opening up and an increase in COVID-19 cases in China. To discuss, we're joined by the convener of the Progressive Health Forum, Dr. Aslam Dasoo. Thanks, Doctor, for being with us as always. What do you think of government's decision here not to impose the restrictions?
Good afternoon, Francis, and best wishes to everyone watching for 2023. I think this is the correct decision to make. It follows science and it follows experience. It may be useful just for me to give you a brief context of what happened in China. With its zero COVID policy and draconian lockdowns, it thought it may overcome the pandemic. But that is not the case, and countries around the world have discovered that. And when you open up after such a severe lockdown, you tend to get a surge. So what we're seeing in China right now is that surge. And, it's just because of its vast population that the numbers seem so alarming. But the surge in cases, hospitalizations and deaths, tends to follow a proportional amount of incidents when you compare it to the rest of the world. So what is happening there is not surprising. Second, it's important to understand we're dealing now with the Omicron variant. To the extent that there may be something new in China, it's unlikely, but we haven't, there isn't full information coming out of China. So we're operating on the basis that it's the Omicron variant and its various subvariants. And it's important to understand that the subvariants may have some immune escape capabilities to a greater or lesser extent than others, but none can escape immunity entirely. And robust T-cell immunity remains against Omicron.
Yeah.
So we're not likely to see anything different at this point.
Haven't you pointed out the big issue that we're not getting full information out of China? So, like you say, there will always be some immunity, but the concern is that anything is possible that China is not telling the world. The belief is that the cases are being vastly underestimated as well. So in that sense, couldn't we be making ourselves vulnerable?
No, I don't think so. I think even though the information from China is sparse, there is sufficient international collaboration to rule out, I think, the possibility of a nasty new variant. I think, the exact numbers may not be, correct as correct as we would like. But I do know the WHO is meeting the Chinese authorities tomorrow, and things will become clearer when that happens. But on the current information, we don't believe that, South Africa is taking an incorrect stance here. We understand very clearly that travel restrictions have not had any appreciable impact on transmission or circulation. We know this through hard experience, and we have modeled it now. And I think the whole world, apart from the few countries that have imposed travel restrictions, is ad idem with that. That's the scientific opinion. I think, there was an article in The Guardian a couple of days ago, which, stated that the UK authorities, in imposing this travel restriction, like the other countries that have, did so against the direct specific advice of their health authorities. Now, I know it's a newspaper report and we won't necessarily go by that, but if that is the case, then what we're probably seeing is some kind of political posture being taken by countries vis-a-vis China. And I think for now, the way we are approaching this situation, continuing surveillance, continuing, keeping an eye on the situation. So even if infected patients or infected nationals from China do end up on our shores, we'd know that soon enough. And even if they did, the chance of spreading here is quite low, because up to 90 to 95% of the South African population has shown seropositivity now to the Omicron variant and several of its subvariants, which means that immunity here is robust. And there's very, very unlikely to be any surge emanating from anyone who is infected visiting our shores.
So let's end with that. So you're saying we're pretty safe, no need to rush out and all get vaccinated again, because the emphasis was on vaccinating people who were elderly or with underlying diseases in the first place. Does that remain the case?
Very much so. I think that's correct, and I should have mentioned that earlier. Look, we are still in the grip of the pandemic. And case numbers are increasing in several countries around the world, including some of these which have now imposed restrictions, and perhaps they've done so because of the fear that that will just increase their numbers. However, South Africa has vaccinated over 60% of its very high-risk population, which is an appreciable amount. It's nowhere near where we need to be. But with natural immunity and vaccination, I think the amount of immune response in the general population appears sufficient. However, for all of those above the age of 55, booster shots are being recommended. The Department of Health has opened up vaccination with the 5th shot now if you've been taking the Pfizer vaccine, and 4th if you've been taking the J&J. So we would urge everyone who has not taken a booster shot in the last 6 months to do so. And if you haven't taken a booster at all, do so immediately. Because the last thing you want is to get infected. And especially if you've got comorbidities in a high-risk group, you want to avoid severe illness. And, you also want to avoid, if you do get a mild infection, the possibility of long COVID, which is just debilitating for so many people. So caution, but no alarm. And I think that's exactly the right approach at this point.
All right. Thank you, as always, Dr. Aslam Dasoo, Progressive Health Forum convener.